This episode of Manage Smarter is brought to you by Sales Fuel Sales Manager Training. Based on the Sales Manager's Guide to Greatness, it's a 36-lesson on-demand program to upskill your sales manager so they can execute your vision and drive consistent revenue growth. Watch a free lesson and find out more at salesfuel.com/SMT. Welcome to the Manage Smarter podcast with hosts C. Lee Smith and Audrey Strong. We're glad you're here for discussions on new ways to manage smarter, hire, develop, and retain talent, improve results, and propel team performance to new heights. This is the Manage Smarter podcast.
Come in. Welcome to Manage Smarter, everyone. Thank you for tuning in. And if you're new to the show, I'm Audrey Strong, the Vice President of Communications here at Sales Fuel.
And I'm C. Lee Smith. I'm the President and CEO of Sales Fuel. So whether or not you're managing a sales team that's selling medical devices or pharma, or, if you're just your sales team or whatever is confused or, has issues in, with their benefits and everything like that, we've got a great show for you today.
Yeah, even I was saying we were going to talk about benefits too. And our guest today is Ed Eichhorn. Hey, Ed, thanks for coming. It's great to meet you, sir.
Well, it's great to be with you today.
Ed is a successful healthcare executive and entrepreneur, as you will find out, and consults for medical societies and healthcare organizations through his company. It's called Medilink Consulting Group. He's the co-author of Healing American Healthcare, a book that describes a universal healthcare plan for the U.S. that would actually save our country about $1 trillion, give or take some change, right? And Ed recently founded the Healing American Healthcare Coalition to keep healthcare professionals informed on the important research and industry news. And so you're really an expert in this massive landscape. I mean, one of the things that we wanted to talk about is the managing of benefits and how managers and companies can maybe, if you've got some tips on how to save the company money.
Yeah, especially when the managers are having to have difficult conversations with employees because the benefits programs have changed, as they tend to do every year at the start of the year. And especially in light of pandemic and cost cutting and everything like that, that's something the managers have to deal with.
Absolutely. It's a real challenge because for companies that provide insurance for their employees, which is more than 150 million covered lives now, the largest section actually of healthcare, it is interesting because there are usually very small numbers of regional competitors for their business. When I was dealing with that a great deal, I would hire a broker. He would come in, analyze our employee cost structure and what our use of healthcare was. And he would always come back with the same healthcare provider every year because that was pretty much the only one we could do business with here in New Jersey and get a reasonable deal. And they face great challenges because, as you know, the co-pays have gone up quite a bit over the last few years. And the average cost to insure a family is generally around $20,000 now. The biggest thing that came up very recently is it was learned how much insurance brokers were being paid to bring the business in. And companies can go and ask about that factor. They're paid 3 to 6% of the package. Wow. Plus, if they do really well, they can get 6-figure bonuses from the insurance company for their performance. So an area to ask about is certainly how the coverage compensation occurs and what is paid to the insurance broker that represents the insurance company for the employer.
So if you're a sales manager, you've got a salesperson and, they have, concerns or they're upset about the health insurance program, that it can be very tempting for the sales manager just to boot that to HR and say, you go talk to them, they handle all the benefit stuff and like that. I think that you might miss an opportunity there to show some empathy and some caring for your employees for some of the stuff that they're going through at that time, wouldn't you think?
Well, yeah, I think a basic selling skill that we might agree with and a basic management skill is listening. And I think in managing a team, you need to listen to understand what their concerns are. And it's perfectly fine to send them to HR once you know what their concerns are in healthcare, so that when you have management meetings, you can bring that message back to management and say, this is what is concerning our team. And, healthcare costs can be high, but turnover is a very high cost.
Mm-hmm.
And if you have really good sales professionals within your organization, and you're losing some of them over the issue of benefits as well as other things, that's a high cost.
So funny you bring that up, because I have in front of me a study that was done by the Society of Human Resources, and 56% of U.S. adults with employer-sponsored health benefits said that whether or not they like their health coverage is a key factor in deciding to stay at their current job. 46% said health insurance was either the deciding factor or a positive influence on choosing their current job. Is that overstated, or do you think that sounds about right?
No, I think it's about right. And in some industries, we have between 3 and 6 million openings in the United States. And healthcare in those industries can be a deciding factor as to whether or not someone wants to go to work in that company. The reason we wrote our plan, in part, was because we thought costs were too high and we needed to provide more choice and more flexibility. A study that I often quote during the campaign for Democrats to compete for the presidency was done by 538.com. And what they did was they went to Democratic registered voters and they said, are you in favor of Medicare for all? 70% of them said they were, until they realized it impacted choice. And the number in favor of Medicare for all dropped to 38%. And the final analysis was, even though 70% of them were in favor of Medicare for all, 88% of them said, I want to keep my own health care, whether we have Medicare for all or not. So choice in healthcare is a very important issue that we all want in what our coverage might be, and also who cares for us. So I think as we go forward, employers need to have a way to embrace choice. And in our healthcare plan that we wrote about in Healing American Healthcare, we described what we called an all-care plan. And in that plan, we suggest that all employers should provide healthcare coverage as they do in Germany and Netherlands, Switzerland, and a few other nations, but that they could have choice. The employers could be self-insured, use private insured, or use the all-care plan that we priced out based on Medicare that would reduce their cost by as much as 30%. And we think the national discussion on healthcare should be revitalized during the current administration and the new Congress, because I think it's time for us to move to a universal healthcare plan that people can accept. And it addresses some of the things we've learned during the pandemic that are longstanding issues that need to help people who are employed but don't have healthcare through their employers.
Interesting. What other aspects of the pandemic have been affected that are different in the system for employers and employees?
Well, I think there are cost issues that need to be determined, because in some cases, the injections for the vaccine are covered nationally. And sometimes there's a bill that comes up for that. And another important thing that's just been in the news recently is some physician practices began to buy equipment for testing for the virus. And, the reason they bought it was you could go to the doctor, not feel well, be tested, and in 15 minutes you would have a result that said you may have the virus. And it turns out insurance companies are only reimbursing them for 50% of the cost of the reagents. It costs about $40 for the reagents, and they're getting paid $20. So physicians are not using the equipment they bought because they can't make it pay. Things like that need to be addressed so that we can have a better way of tracking the virus. And the more you track it, the more you can figure out where it came from, and the more you can do to deal with coverage and vaccination and special efforts that may be needed in a town or in a region. So I think things like that are being learned as people go forward to try to treat patients for potentially having the virus. And, getting the vaccine out more rapidly than we are now in the states that we all live in is really an important factor to bring this under control and to bring business back to normal for so many companies.
Regardless of your policy preferences, healthcare is almost certain to be brought up over the next couple of years in Congress and in Washington, D.C. And certainly the folks in pharma, the salespeople there, or whatever, have already encountered numerous changes to how they have to do business. They can't do the lunch and learns. They're only allowed to say certain things and so on. Like, given what you think might be on the horizon for healthcare? Like, how will that impact the sales staffs of medical devices, medical imaging, medical services, pharma going ahead, you think?
Well, I think the sales aspect for sales reps in pharma might not change a great deal. However, like you said, lunch and learns are not part of the field anymore. I think there are basic issues in how pharma prices some of the things that it sells. In 1983, we got a great law called the Orphan Drug Act. And that means that pharmaceutical companies would be encouraged to develop medications that impact less than 200,000 people around the world. And more than 300 drugs have been developed, and a number have actually been found to have an application as an orphan drug. The problem is that since 1983, the cost of these drugs has gone up by a factor of 64 times.
Wow.
So today, the 7 most expensive drugs are actually hepatitis C drugs mostly, and they cost $50,000 to $80,000 a month for a course of treatment that could go on for 3 months. Those kinds of things need to be addressed in a way that makes them a little bit more affordable. And if you make drugs a little bit more affordable, you also lower the cost of regular insurance, because their cost of pharmaceuticals will go down a bit. The other thing I think that's important in this area is whether or not the nation during this Congress, which will be very, very difficult, will move towards a national drug negotiation process. All the other democracies in the world have that. We don't. And because we don't, we pay 2.5 times more for pharmaceuticals that are, patent protected pharmaceuticals than the rest of the world does. And we don't use any more than we do. We just pay more for what we use. It's not like we are treated differently. So those kinds of things will affect the industry, but I believe that pharmaceutical sales reps will still go and call on doctors, will still, make presentations about what's available, but I think the price points are going to change it. And that could certainly change their compensation in some way. But I think nationally, we need something like that to impact a whole number of medications that are sold.
Put a percentage on it for me. It's like, because we've heard about this through the Obama administration, through the Trump administration, and now the Biden administration. I think I remember even hearing George W. Bush talking about this kind of thing. It was like, why is it that this has not been able to happen? Because it seems so common sense.
Well, having worked for medical societies in the past and been a strategist for their lobbyists, I think that's part of where the issue is. The pharmaceutical industry has over 880 lobbyists. There's 330 more lobbyists than there are senators and members of the House of Representatives. And when Obamacare was being thought through by the Congress, and I was advising medical societies at that time, there was a lobbyist meeting with a congressional office, every 15 minutes. There was more money spent on lobbying during that quarter than any other quarter in our history. So I think legislators, lawmakers are under a lot of pressure when they receive a number of highly educated lobbyists who bring a lot of data for them that represents the point of view of their employer or the company they're representing. So I think it's an important, real challenge to figure out how to address this in a reasonable way. There are 3 or 4 states now that are working to import drugs from Canada. And they are probably going to start doing that. And that will come in at a lower price. So I believe pharmaceutical companies will look at that, since people will be buying drugs that they manufacture either in the United States or abroad and getting them at a lower price in relatively large amounts. That will cause them to think about their pricing if they want to sell the drugs domestically.
What's the which states, I'm curious, are those? Do you happen to know?
New England is several states in New England.
Oh, okay.
Colorado is thinking about that as well.
Interesting.
And the negotiations, basically Canada is saying, we are willing to do this, but we're not going to compromise availability of these drugs for our citizens.
That makes sense.
Mm-hmm. And the pharmaceutical viewpoint is we don't think it's safe to import drugs from other countries. Now, in my view, if it was manufactured and it met the quality standards of the company and was able to be used internationally, why couldn't you use it here? Why would it be unsafe? Right?
It seems to me that they're kind of indicating then that the product of theirs that you buy in a foreign country is not equivalent in quality to the product that you have in this country, and that's very concerning to me, actually.
Well, I just don't think it's true.
I don't think it's true either.
It's in a sealed
I don't
package.
think it's true.
I mean, it's in a sealed, marked package.
Sure.
You're just talking about the arbitrary border of a line that this is Canada and this is this. It's the same product.
Sure.
Question for you: the 3 to 6% broker issue. So we forgot to give our listeners a tip. What is the tip? Shop around for a broker that takes a lower cut.
Shop around and ask what they're paid.
Yeah.
So that allows you to shop around on that aspect. So that might be a bit lower for you. Sure.
Okay. So you're also an expert in managing very large organizations, as you said. I've got it jotted down here on my handy dandy notes. Mobile medical testing centers, a big network, and a whole bunch of imaging centers. And so I would love for you to tell our viewers and listeners a little bit more about your tips on managing very complex, large organizations. How much territory did you have that you were oversight?
The lower 48.
Yeah. Okay. Wow. Okay.
And when we started our service company, we were doing medical testing. And when we started, I was calling on nephrologists nationally and using software products to keep notes because I was calling quite a lot of physicians to promote our service. And doing that allowed me to learn how to train the sales force that we eventually developed for that company. And then when we sold that company, the acquiring company had us start managing larger sales groups. So the largest sales group I managed was about 125 people. And it was very, very important to have very, very clear meetings that we scheduled when we'd have a national meeting. We wanted to make sure we were working on the issues within our product portfolio that we thought should be doing better in the market. We wanted to learn why they weren't doing as well. How could we train people to do a better job of presenting features and benefits, and to make sure that everyone had the same message in the same way that they would internalize to bring to their region of the country. And that was really important to making sure that the sales group was able to meet the goals of the company. And naturally, we would then, from those meetings, we needed feedback to senior management to say, well, this is what you want to do, but it might be really challenging for these reasons that we've learned from our colleagues that are in the market every day. So again, I think listening and communication and maintaining lines of communication is very important. I also, with the knowledge of my supervisors, I would take a call from anyone. Any sales rep could call me and I would say, what's the issue? Let's talk with your sales manager or your director about this. And let's make sure we bring it to the fore, make sure that we learn whether or not it has weight or not. And that helped us to improve performance quite a bit. And, I think making sure your colleagues trust you and are willing to work with you is really important so that you can get to the real truth of what's going on in the market.
Through your consulting group, I see that one of the areas of expertise that you have is involves sales compensation plan and design.
Yeah.
What kind of advice can you give to sales managers then about, setting up the right levers for a effective sales compensation plan?
Well, I think it has to be based upon what you want to accomplish. What is it that the universe of your business needs to do? And what is most important to the company? Where does the profit come from? What can you do to make sure that you're compensating their sales reps in a way that is both fair and also accomplishing the goals of the company? And there are a lot of things that could go into that in a very specific way. I also, in some of the more complicated plans that we help to set up, we would be like an outside adjudicator. A sales rep would say, I did this, and I didn't get paid. And we would say, well, okay, let's take all of you know what you're submitting. Let's go compare it to the plan. Let's have your, manager in this discussion in as a collegial way as possible, and say, okay, well, actually, you didn't make the plan for this reason, or actually, he did make the plan, or she did make the plan. You need to pay her, because anytime we came across a plan where it was announced, people started on the plan. It was supposed to occur for a whole year, and the company decided to change the plan 3 months into the plan. That's not a good thing. That creates turnover because people are not going to trust the people for whom they are trying to generate sales. So, I think it's very important to have a fair plan, one that does what the company wants, motivates the employees to get on the target. And then when people do a really good job and you reward them, you want everyone else to know that they did a really good job. So we would always make sure that when there was a national sales meeting that those great successes were highlighted and the successful employees would be rewarded, but we'd ask them to tell everyone else how they were able to do so well, so that we could gain better performance in the next cycle.
Yeah, don't move the goalposts all the time. Right?
Yeah. People hate that. Yeah, go figure.
We got about 2 minutes left, Ed. So I know that you say that medilinkgroup.com is your website, and then you want people to get your book and also join your coalition at healingamericanhealthcare.org, right? Can you tell us a little bit about what you want people to do and what that looks like?
Yeah, at healingamericanhealthcare.org, we provide a newsletter twice a month. It's called the 3-Minute Read, and we encapsulate articles into that. And there's usually 5 very significant articles and perhaps a copy of my blog in that for them to read.
Great.
And it takes 3 minutes to read it. We monitor 50 publications, and we write it every 2 weeks. And we also have just recently started Healing American Healthcare blog, where we discuss the 3-minute read, and I interview physicians and other people in healthcare about current topics at that time. We also publish information about how the United States compares with other nations with the coronavirus on an apples-to-apples basis with respect to infections and death rates, so that people can see exactly where the country stands and what actions ought to be taken to improve that performance. And anyone who joins our coalition gets a free e-copy of my book, Healing American Healthcare. We'd like to hear from our coalition members. We are now preparing, discussions of these key issues that people can watch on YouTube or through our podcast that we just started doing over the last 4 or 5 weeks.
Sounds great. I'm going to definitely get on. I want to read about the U.S. versus the other international community countries, because I don't think I've seen an apples to apples. So I'm anxious to see that.
We're happy to share that with you.
Yeah. Thanks. This has been very informative. We appreciate your time today.
It's been my pleasure to be with you, and best of luck and stay well.
Thanks for listening. If you enjoyed the show, please rate and recommend on iTunes, Overcast, or wherever you get your podcasts. You can also get more great information at salesfuel.com.
This podcast is a part of the C-Suite Radio Network. For more top business podcasts, visit c-suiteradio.com.